Charles Cullen, the Angel of Death. He lurked in the sterile halls of hospitals, not as a healer, but as a harbinger of death. Charles Cullen, a nurse by profession, became one of America's most prolific serial killers, a chilling testament to the darkness that can hide behind a caring facade. Give a like and subscribe. Leave a comment. Born on February 22, 1960, in West Orange, New Jersey, Charles Edmund Cullen entered a world already tinged with sorrow. He was the youngest of 8 children in a working-class Catholic family. His father, a bus driver, passed away when Charles was just 7 months old, casting a long shadow over his early years. Cullen described his childhood as miserable, a breeding ground for deep-seated insecurities. He claimed to have been constantly bullied, a torment that likely fueled his inner turmoil. At the tender age of 9, he made his first suicide attempt, a desperate act of a child overwhelmed by despair, by drinking chemicals from a chemistry set. The loss of his mother, Florence Cullen, in a car accident in 1977, further shattered his already fragile world. He was 18 years old, in his senior year of high school, when this devastating blow struck. Her death was a pivotal moment, deepening his sense of isolation and loss. After graduating from West Orange High School, Cullen sought refuge in the United States Navy. He served aboard the submarine USS Woodrow Wilson, rising to the rank of Petty Officer Second Class. But even in the structured environment of the military, his inner demons persisted. He was reportedly hazed and bullied by fellow crewmen, exacerbating his feelings of inadequacy. An unsettling incident occurred when he was found wearing a surgical mask, gloves, and scrubs at the missile controls, raising serious concerns about his mental state. Reassigned to the USS Canopus, Cullen's struggles continued. He attempted suicide and was subsequently committed to a Navy psychiatric ward. In 1984, he received a medical discharge from the Navy, marking the end of his military career and the beginning of a new, equally troubled chapter. Seeking a fresh start, Cullen enrolled at Mountainside Hospital's nursing school in Montclair, New Jersey. He surprisingly became president of his nursing class and graduated in 1987. This achievement masked the darkness that continued to fester within him. His first job was at the burn unit of St. Barnabas Medical Center in Livingston, New Jersey. It was here, amidst the suffering and vulnerability of patients, that his murderous impulses began to manifest. He married Adrienne Baum in 1987, a union that would soon be strained by his increasingly erratic behavior. Adrienne became increasingly disturbed by his unusual behavior and abuse of the family dogs. The marriage deteriorated, culminating in her filing a restraining order against him in 1993, a desperate attempt to protect herself and her children from his escalating instability. The first documented murders occurred at St. Barnabas Medical Center. On June 11, 1988, Cullen administered a lethal overdose of intravenous medication to a patient, marking the beginning of his reign of terror. He continued to kill other patients at St. Barnabas, including an AIDS patient, his actions shrouded in secrecy and deception. In January 1992, Cullen left St. Barnabas amidst an investigation into contaminated IV bags, a suspicious circumstance that should have raised red flags. He quickly found a new position at Warren Hospital in Phillipsburg, New Jersey, where his deadly work continued. At Warren Hospital, he murdered 3 elderly women with overdoses of digoxin, a heart medication. His methods were subtle, his motives obscure, and his victims defenseless. After a contentious divorce, he moved into a basement apartment in Phillipsburg, further isolating himself from the world. In March 1993, he broke into a co-worker's home, a bizarre act that hinted at his unraveling mental state. He pleaded guilty to trespassing and received 1 year of probation, a minor consequence for a man who was already a serial killer. He took 2 months off from work and was treated for depression, a temporary respite that did nothing to address the underlying darkness within him. A 91-year-old cancer patient reported that Cullen injected her with a needle, a chilling foreshadowing of his future crimes. Cullen then worked in the intensive care unit of Hunterdon Medical Center in Flemington, New Jersey. He admitted to murdering 5 patients between January and September 1996, his body count steadily rising. His ability to move from hospital to hospital, undetected and unhindered, is a damning indictment of the healthcare system. After Hunterdon, he found work at Morristown Memorial Hospital but was soon fired for poor performance, a rare instance of accountability. He was then hired by the Liberty Nursing and Rehabilitation Center in Allentown, Pennsylvania, where his behavior continued to raise concerns. He was accused of giving patients drugs at unscheduled times and was eventually fired after being seen entering a patient's room with syringes in his hand. A patient's death at Liberty Hospital was attributed to Cullen, further solidifying the suspicion surrounding him. From November 1998 to March 1999, he was employed at Easton Hospital, where he murdered yet another patient on December 30, 1998. His relentless pursuit of death seemed unstoppable, his victims mere pawns in his twisted game. He then took a job at the burn unit of Allentown's Lehigh Valley Hospital Cedar Crest, where he murdered one patient and attempted to murder another. His pattern of killing was becoming increasingly clear, yet he continued to evade detection. He moved on to the cardiac care unit at St. Luke's Hospital in Bethlehem, Pennsylvania, where he murdered at least 5 patients and attempted to kill 2 more. His actions were becoming bolder, his disregard for human life more pronounced. In a desperate act, he attempted suicide by lighting a charcoal grill in his bathtub, a cry for help that went largely unanswered. He resigned from St. Luke's in June 2002, leaving behind a trail of death and suspicion. He began working in the critical care unit of the Somerset Medical Center in Somerville, New Jersey, where he killed at least 13 patients and attempted to kill at least 1 more by mid-2003. It was here that his reign of terror would finally come to an end. Somerset began to notice Cullen's wrongdoing, but the wheels of justice turned slowly. He was fired on October 31, 2003, ostensibly for lying on his job application, a flimsy excuse that masked the true extent of his crimes. It was Somerset nurse Amy Lovren who finally alerted the police, her courage and determination ultimately leading to Cullen's arrest. Her actions saved countless lives and brought a measure of justice to the victims and their families. Cullen was arrested on December 12, 2003, and charged with 1 count of murder and 1 count of attempted murder. He admitted to murdering Florian Gall and attempting to murder Jin Kyung Han, but the true scope of his crimes was far greater. He told detectives that he had murdered as many as 40 patients, a chilling confession that sent shockwaves through the healthcare community. In April 2004, he pleaded guilty to killing 13 patients and attempting to kill 2 others, a deal that spared him the death penalty. He promised to cooperate with authorities if they did not seek the death penalty, a calculated move to avoid the ultimate punishment. He later pleaded guilty to the murder of 3 more patients in New Jersey and, in November 2004, to killing 6 patients and trying to kill 3 others. On March 2, 2006, Cullen was sentenced to 18 consecutive life sentences, a fitting punishment for his heinous crimes. He later received an additional 6 life sentences, ensuring that he would spend the rest of his days behind bars. Cullen stated that he had overdosed patients to spare them from being seen going into cardiac or respiratory arrest, a twisted justification for his actions. He also claimed that he gave patients overdoses so that he could end their suffering and prevent hospital personnel from dehumanizing them, a self-serving narrative that masked his true motives. Investigators stated that Cullen may have caused patients to suffer but did not realize it, a disturbing possibility that highlights his lack of empathy. Cullen told detectives in December 2003 that he lived most of his life in a fog, a possible explanation for his detachment from reality. Cullen's ability to move from facility to facility undetected was largely due to the lack of requirements to report suspicious behavior by medical workers. New Jersey and Pennsylvania, like most other states, required healthcare facilities to report suspicious deaths only in the most egregious cases. Employers feared investigating incidents or giving a bad employment reference for fear of such actions triggering lawsuits, a systemic failure that allowed Cullen to continue his killing spree. After Cullen's criminal conviction, many of the hospitals at which he had worked were sued by the families of his victims. Prompted by the Cullen case, Pennsylvania, New Jersey, and 35 other states adopted new laws aimed at improving patient safety. The 2004 Patient Safety Act increased hospitals' responsibility for reporting serious preventable adverse events. The 2005 Enhancement Act required hospitals to report certain details on their employees to the New Jersey Division of Consumer Affairs. The story of Charles Cullen serves as a chilling reminder of the darkness that can lurk within the human heart and the importance of vigilance in the healthcare system. His crimes have been documented in various forms of media, including books, documentaries, and films. The 2008 direct-to-video film Killer Nurse, written and directed by Uli Lommel, was loosely based on Cullen's life. The CBS News magazine show 60 Minutes featured an interview with Cullen, offering a glimpse into his twisted mind. On June 25, 2020, the British television channel Sky Crime aired the documentary Charles Cullen, Killing for Kindness. The film The Good Nurse, adapted from Charles Graeber's non-fiction book The Good Nurse. A true story of medicine, madness, and murder was released on Netflix on October 26, 2022. Capturing the Killer Nurse is a 2022 documentary film about Cullen, providing a comprehensive account of his crimes. A 2023 episode of the podcast Criminal is an interview with Amy Lovren and covers the story, offering a personal perspective on the events. The case of Charles Cullen is a stark reminder that evil can exist in the most unexpected places. His story forces us to confront uncomfortable truths about the healthcare system and the human capacity for darkness. If you found this video disturbing and informative, please like and share it to raise awareness about patient safety. Subscribe to our channel for more in-depth true crime analysis. Leave a comment below with your thoughts on the Charles Cullen case and what measures can be taken to prevent similar tragedies in the future.